Now that I have been diagnosed with early-stage breast cancer, I understand that surgery is one of the pillars and main components of treatment. I have been given the choice of whether to have a mastectomy or breast conservation treatment. Is my understanding correct that mastectomy is the surgical removal of the whole breast, while breast conservation treatment involves complete removal of the cancer with a rim of normal tissue while preserving the uninvolved breast tissue?
That is correct, and it is an important decision that you need to make. Perhaps we should review the available research data on the subject of breast cancer surgery so that you can make an informed decision about your treatment. Breast conservation treatment was introduced as an alternative to mastectomy about 50 years ago. The first studies comparing breast conservation treatment and mastectomy found that breast conservation resulted in similar cure rates as mastectomy. However, over the last 2 decades, there is accumulating evidence that breast conservation treatment results in better survival outcomes than mastectomy.
That's difficult to get my head around because it makes sense to me that the more aggressive the treatment, the better I will be in survivorship. So why is it that breast conservation therapy is equivalent and may be associated with even better cancer control?
We don't have all the answers to that yet, but there are some researchers working on studies to find out the reasons, so stay tuned. We might have a video on that subject soon. But for now, as mentioned earlier, we have the data from the first studies, which began more than 50 years ago, which show equivalent survival, and we have more recent data which demonstrate that breast conservation treatment may have improved survival outcomes compared with mastectomy. Apart from better survival outcomes, there are also studies showing lower surgical complication rates and better quality of life after breast conservation treatment. Please note that the evidence we have comparing breast conservation with mastectomy is mostly for early breast cancer. So each individual situation needs to be assessed by a surgeon for the appropriate application of breast conservation. May I encourage you to look through the videos on this channel to view the data and evidence that addresses your questions so that you can make a decision for breast cancer surgical treatment that is best for you.
That's certainly food for thought. It is a little confusing. Maybe I will check out the videos so that I can clarify the issue for myself. Thanks.
You're very welcome. See you in those videos. Cheers.